I just think we ought to start off giving Mr. Deepak Doshi a hand for letting us be here tonight. Doshi's house. Awesome, brother. Awesome. On behalf of Miss Linda Sivarito of the UH Tillman J. Fertitta Family College of Medicine and our other community partners, we welcome you to our second in a series of meetings we call Trade Talks. Make some noise right there. The Trade Talks are opportunities to greet, to meet, and to eat as we gather to discuss health issues in the greater Third Ward community. Like you, we don't want to just talk about the problems, but we want to hear real and relevant solutions to the health challenges in our community. Somebody say amen. In other words, people can just search and test to death. We need to get some answers. Amen. When we began this journey some time ago, we did very good. Now, with your help, we're doing much better. But our focused, faithful, family-like determination in leaving a lasting love of hope, help, and healing as a result of our combined efforts is when we will be doing our best. Amen. We simply invite you to join us in our humble efforts to accomplish these lofty goals, these lofty but worthy goals. Thank you. Look at your neighbor and just say thank you, thank you, thank you, thank you, thank you. Thank you for being here with us. We greatly appreciate you for spending your valuable time with us. So tonight, we simply say welcome, welcome, welcome. Amen, amen. Munish Chawla, along with his wife, is the co-founder of Peaceful Planet Foundation, a 501c3 nonprofit organization dedicated to fostering peace, health, and wellness. He also serves as volunteer clinical faculty at the U of H Fertitta College of Medicine. His two main passions are mindfulness and lifestyle medicine. Somebody ought to say amen right there. And today, he will be speaking to us about the role of lifestyle medicine in combating diabetes and other chronic diseases. Would you please welcome, they call him Dr. M, Dr. Munish Chawla. Give him a hand, please.
You guys are good? Okay. I want to thank everyone for being here. I want to thank the Fertitta College of Medicine, Linda Sivarito, Dr. Buck. I want to thank Change Happens, Deepak Doshi, Dr. Lee, all of the distinguished guests that are here, and of course, Bishop Rush. Thank you very much for inviting us. And really, this is like it says, dinner and discussion on diabetes. And I'm going to talk more than just about diabetes. This is lifestyle medicine approach to diabetes and other chronic diseases. Okay, so too many, let me go a little further. So I'm going to go over the not so good news first. Okay, this graph shows in 1958, less than 1 million Americans had diabetes in 1958. And in 2006, this went up to nearly 18 million. Okay, and in this next graph, you'll see from 2006 to 2022, that number has more than doubled, from 18 million to 37 million. Okay, and the other graph that you see here, the green bar, that's pre-diabetes. This is a lot of people don't have the symptoms, but there's abnormality in their metabolism, abnormality that we can test on blood tests, which shows they're pre-diabetes. This also makes you at higher risk for heart disease, cancer, and other things. And there's a very high chance that if you have pre-diabetes, you're going to get diabetes. So if you add 37 million to 96 million, that's almost over actually 130 million folks in the United States that don't have good sugar metabolism, that really can't digest their food very well. That's more than a third of the population. Okay? And as you all know, this is not just limited to diabetes. You know, rates of obesity, heart disease, cancer, and even autoimmune diseases. These are skyrocketing. Ever since the Second World War, you know, lupus, rheumatoid arthritis, these things, when we were in medical school, if somebody came in with these, the chief resident would gather us, said, this is not so common a disease. This is what psoriatic arthritis or rheumatoid arthritis looks like. Now we have so many patients in our clinic suffering from these autoimmune diseases. So then the question is, you know, what's causing all this? Because, you know, our genes, they don't change in a matter of 50 years, right? So before we kind of get to that, I'm just sort of curious, what do you all think what diabetes is? You know, what's the abnormality? Right, it's caused by diet. It can't, you know, has a large part to do with it. What else is your understanding for diabetes? Yeah. Yeah, that's a very good point. So actually, I'm going to jump to the next slide. So there are two types of diabetes, okay? Type 1 and type 2 diabetes. And what Sean just said, in type 1 diabetes, the pancreas doesn't produce insulin, okay? That's a different disease. It's an autoimmune disease, as a matter of fact. But for that, it's harder to treat. But that accounts for 5, maybe 10%, less than 10% of the cases. The disease I'm going to talk to you about today is type 2 diabetes. Okay, that's more than 90% of the diabetics in this country have type 2 diabetes. And then some of the symptoms you all may know, a friend or a relative that may have it. You know, there's high blood sugar, sometimes you get excessive thirst, frequent urination, decreased energy. You just don't feel very good. Okay? And then the question is, what is causing this disease? In the past, we used to think, you know, it may be the genes, but now we know that the root cause, what's causing diabetes, is insulin resistance. Okay? Has anybody heard about insulin resistance? Is that a new concept? Okay. So let's take a little bit of time to kind of go over that. So like Sean mentioned, in type 1 diabetes, the person cannot produce the insulin. Okay? But in type 2 diabetes, the pancreas is producing lots of insulin. It's just not working very well. Okay? This is an analogy I use with some of my patients. So think of glucose or sugar in the blood like a really shy teenager, okay? And think of the cell as the dance hall, okay? So this shy teenager is in the hallway, okay? It wants to go into the dance hall, wants to go into the cell, but it can't do it alone. It needs a chaperone. The chaperone is insulin, okay? So if everything is working well, the insulin takes the sugar from the blood and puts it inside the cell out of harm's way. Okay? So, but insulin resistance is the insulin is there, but it's not able to do its job. Then the question is, you know, why is the insulin not able to do its job? So the door into the dance hall, if it's plugged up, if it's jammed, insulin tries to open the door so the sugar molecule can get in, but it's not able to open the door. Okay? So then what is blocking the door? What is gumming up the door that the insulin can't open the door? Okay? It's basically mostly our diet. It's, lack of exercise, all these other things. And in diet, it's excess refined carbohydrates, excess protein. And the most sensitive thing that gums up the door is saturated fat. Okay? So if the fat gums up the door, even though there's lots of insulin there, the insulin can't open the door. So all the sugar stays in the hallway, stays in the bloodstream. And then you get high blood sugar. Then you get all these symptoms. The high blood sugar causes damages to the eyes, to the kidneys, to other things. But those are all symptoms of the insulin not able to do its job. Okay, I really want to spend a little bit of time on this. If I didn't explain it well, I'm happy to do it again. Did that seem good? Okay, awesome. All right, so this is a slide actually a little bit dated. It's from 2009. This is data from the USDA. They track, what are Americans eating? And from this slide, we can see that 63% of our calories are coming from added fats, oils, sugars, refined grains, crackers, junk food, candy, chips, cookies, these sort of things. Another 25% is coming from animal foods like meat, dairy, eggs, and other things. And only 12% is coming from plant foods. Okay? And this is a recipe for diabetes. Okay, so I'm going to skip a lot of stuff, but kind of give you a summary. What does the research show how we should be eating, how we should be moving? So WHO, that's the World Health Organization. AICR is the American Institute of Cancer Research. AAND is the American Academy of Nutrition and Dietetics. If anyone's talked to a registered dietitian, they belong to this organization. Okay, and the American ACC is the American College of Cardiology. So we're all familiar with the American Heart Association. All of their data, all of the research body is the American College of Cardiology. All the cardiologists in this country are part of this organization. All these organizations and many others, their recommendations are we need to increase our fruits and vegetables. We need to decrease the saturated fat. When I was talking about, what's blocking the door, what's jamming the door, it's, excess refined carbohydrates, excess protein, but the number one thing that's jamming the door is saturated fat. Okay, saturated fat in the American diet is coming from cheese and meat. Those are the two biggest sources. Okay, so that's the recommendation, that we reduce things. Okay, then it also says we need to reduce salt, sugar, and oil. Okay, where's this coming from? This is coming from chips, candy, sodas, exactly, crackers, right? All that is coming from that. All right, then their recommendation is to increase physical activity and, do your best to maintain a healthy body weight. So those are the recommendations that come from these organizations. So if we get these things, we get closer to what the medical research indicates what we should be doing, we can do a wonderful job of preventing diabetes. But if we want to go one step further, I want to introduce you all to the new field of lifestyle medicine. Who in here knows about lifestyle medicine or has heard about it? Wow, lots of hands. That's awesome. Okay, this is a medical specialty that literally started in 2005. Okay, And they looked at the research. They said, okay, it's wonderful that we can do all these things to prevent diabetes, but a third of the country has prediabetes or diabetes and numerous other diseases. Is there anything we can offer them? Okay, this is where those 6 pillars came in. So according to research, if most of our calories come from whole plant foods, and what do I mean by that? It's perfectly fine to eat potatoes. It's the potato chips that are a problem, okay? Physical activity. If we engage in physical activity every day, that's what the research says. You know, we as human are bipedal locomotion. That's what we are good at doing. So any sort of physical activity you can do every day is just fine. Okay, it doesn't matter what it is. Finding healthy ways to manage our stress, going in the garden, exercise, mindfulness, prayer, yoga, anything that works for you, healthy ways to manage stress, that has a big role in chronic diseases. If we find effective, healthy tools, that can help tremendously. No one argues about, not doing tobacco or other drugs and really limiting alcohol. But 50 years ago, people argued that maybe tobacco is not so bad, right? But now everybody's on board. Getting a good night's sleep, restorative sleep, that is so crucial for our health. They can take college-age students and disrupt their sleep for 5 days, and they become insulin resistant. Okay, just 5 days. And healthy relationships. This is crucial for our health. The wonderful community, the fellowship that I'm seeing in the room today, this is part of the healing mechanism. This is how we heal together. Enjoying wonderful meal and fellowship, this is an important pillar of lifestyle medicine.
So when you say healthy meals, I just think that a lot of the fruits and vegetables that they offer to us, we buy with our money, they're not even grown like it's supposed to be grown.
Yes.
That's a whole different one.
Yeah. So I'm going to repeat what you just said. She said a lot of the fruits and vegetables we have available in the supermarket, they're grown with lots of pesticides, and they're not very healthy. Yeah, so very good question. So our human body is very resilient. Okay, we can eat unhealthy, eat all these things, be in a toxic environment. It has mechanisms to deal with that. It's when we get too much unhealthy food, too much toxins in our body for any reason, that's when we run into trouble. So just to answer this young lady's question, even if you don't have access to organic food or farm fresh food, you can use baking soda, you can use apple cider vinegar. That'll get rid of a lot of the pesticide residues. This is what Dr. Greger, one of the researchers, says, that if you are eating fruits and vegetables, and even if they have a little bit of pesticide, there are so many healthy molecules in that food, even that's okay. But we want to do even better than that. So just, clean it real well. You can use a little bit of apple cider vinegar or baking soda, gets rid of most of the pesticide residues. Okay. So I'm talking all this to my patients, and, some of them come back and say that, aren't genes important? Everyone in my family has diabetes. I have no choice but to take medications. Yes, sir.
The baking soda, how you take it, tablespoon?
Very good question. I left you kind of halfway hanging, right? Okay. So if you just take 1 table of baking soda, 1 tablespoon, and put a couple of quarts of water, and then whatever you need to wash, you kind of let it sit there maybe for 5 minutes, and then rinse it off.
You don't ingest?
No, it's just for washing it off. Just cleaning the greens, cleaning the, tomatoes, strawberries, whatever you got. Apple cider vinegar.
Excuse me.
Yes.
If we could do this, if we could let him finish and then we're going to have a question and answer period. Is that okay? Is that okay? Yeah, all right.
Okay, so what I want to really get, another big concept I really hope that everyone, feels comes out of this little talk that we have, that genes are not our destiny, okay? Our diet, how we move, how we manage our stress, how well we sleep, what healthy relationships we have, these are powerful levers, okay? They turn on genes that promote health. Even if you are dealt a hand that diabetes is common in your family, the genes that you have are making you more prone to diabetes. Even if you're dealt that hand, if you practice a healthy diet and lifestyle, the body is so intelligent, it can turn on the health-promoting genes and turn off the genes that are going to cause diabetes, heart disease, and other chronic diseases. So, this is really good news. We have the power in our hands, in our forks, in our feet, to heal ourselves. It's a message of empowerment. And this is the new field of epigenetics, which says genetics really plays maybe 20% of the role. The epigenetics, all these healthful things that I'm talking about, they have a much larger role. 80% of whether a person gets diabetes or not depends on these factors. Okay, and then I want to just kind of quickly go over that when we start eating healthy whole plant foods, decrease our processed foods and animal foods, we can significantly reduce our risk for diabetes, but not just diabetes, for heart disease, for obesity, for cancer, and also reduce our risk for getting COVID and how severe the illness is. So this was a study published in the British Medical Journal in June of 2021. And these were actually healthcare workers. Some were nurses, some were doctors, some were other folks working in the hospital. They were exposed to patients coming into the ER who had COVID. 2021 was a very rough year. And they did these diet surveys. And they saw folks who were eating mostly whole plant foods, lots of fruit and vegetables, compared that to the general population, they had a 73% decrease in the severity of COVID. They didn't end up in the hospital, in the ICU, didn't need oxygen. People who were eating lots of vegetables but had some fish and a little bit of other animal products, they still did pretty well. Then they compared the first group who had the healthiest diet, and they compared them to some of the folks who were doing these new diets like keto diets and carnivore diets, even folks in healthcare, okay? And those diets show that you can lose weight, but it comes at a big cost. Then they compared the folks who were eating the most vegetables to the folks who were doing a keto diet, and they found folks who were doing the keto diet, they had a 300% increase or threefold increase in the severity of COVID. Okay, so those diets are not a good idea at any time, but especially with this global pandemic, which hasn't gone away completely. But it's good that we can kind of get together today, and it's a little bit less. So just really want to highlight that this is serious business. Okay, then my patients say, okay, I get it. I need to eat a little less meat, a little less processed food, a little less chips and candy. But where am I going to get my protein? Don't I need meat for that? So this slide is specifically for that. So this is about 3.5 ounces of beans and 3.5 ounces of beef. So the amount of calories that you see is roughly the same. The amount of fat in beans is 1.4 grams. There's 39 grams of fat in the beef. And the main thing I want you to also notice that the protein is roughly the same. So you can get all the protein you need with beans, okay? And sometimes I've had doctors or other family members saying their iron's low. My doctor is recommending red meat. We can see beans have twice the amount of iron. You don't need the meat for the iron. Okay, another question I get frequently asked is calcium. Don't I need dairy for calcium? So this is another comparison which is showing that there is calories in 8 ounces of tofu versus 8 ounces of milk. Tofu has a little more calories. The saturated fat, remember, that was what was jamming the door. The insulin molecule couldn't open the door to let the glucose in. So full fat milk or whole milk has 4.6 grams of fat. And especially when we turn this into cheese, the saturated fat goes even higher. Okay, so that's a major issue with diabetes. And the calcium, as you see, is roughly the same. Okay, another question I get frequently asked in my office, are carbs good for me or bad for me? So this is a good slide, I think, which kind of lets you know what do we mean by whole grains and refined grains. Okay, if you eat whole grains, which means the bran, the outer tough part, that has fiber and lots of minerals, and then the germ has lots of the B vitamins, and then the endosperm is the starch. Okay, so the whole grain has all 3 parts, whereas the refined grains, it takes away the bran and the germ. So most of the nutrition is taken away. Nearly all of the fiber is taken away. So when we eat whole grains, we're getting all this wonderful nutrients, fiber, but when we refine the grain, all the healthful things that nature put in are gone. Okay, so I don't like this slide. I think I'm going to take it out. I don't want to have the thing bad carbs and good carbs. You know, healthier carbs and not so healthy carbs. So refined grains would be, you know, white bread, chips, these sort of things. And in addition, if you fry those things, you're adding lots of oil, lots of empty calories. But carbs like whole grains, vegetables, spinach, berries, avocados, fruit, nuts, and seeds, these are very good for us. These are the things that are going to reverse diabetes. These are the things that are going to reduce our risk for heart disease, for hypertension, and many other chronic diseases. Oops. So this is something we didn't learn very much of it. My wife is here, she's an internist. We didn't learn much of this in medical school. Okay, most of this information is relatively new. So we have changed our diet and lifestyle when we learned about this information. So I love this quote by Maya Angelou. It says, do the best you can until you know better, and then when you know better, do better. Right? So this is a journey. You know, we didn't pick up a journal or listen to some podcasts and immediately changed our diet overnight. But I want to give some tips. I want everyone to pick one thing. I'm going to have one more slide. One thing they can do tomorrow to make their diet a little bit healthier. If you enjoy cereal with dairy milk, maybe try oat or soy milk. If scrambled eggs is something you do frequently, try tofu scrambles. If donuts and muffins are something you typically do for breakfast, try a whole grain toast with avocado. And instead of, you know, just white bagel with cream cheese, do whole wheat bagel with hummus. Just pick one thing that you think that would be easy to start with. Okay, if potato chips, you can switch it with popcorn. Cookies and candies, fruit, and especially dried fruits, are really nature's candy, right? That's what they say about raisins. Instead of crackers and pretzels, there's a wonderful brand called Mary's Gone Crackers. And instead of cheese, maybe trying nuts and seeds. So just pick one thing that you think, okay, I can do this tomorrow. That's going to start you on this journey of eating healthier. Thank you all so much.
Let's give Dr. M a hand. Dr. Munish, Chawla.